Hey everyone, Dr. Morales, come back at you from my home office, and just answering some frequently questions I get from social media. Patients come in, I try to write them down, and hopefully answer maybe a question been on your mind. So this question is specifically related to the health and fitness injuries, specifically bodybuilding, and the question is, when should I have surgery if I'm a bodybuilder? Let's start off the topic with that. Bodybuilding is one of those sports that it's really a 24/7 sport. You can't cheat on this. Like, everything you eat, you're sleeping, you're drinking, you're training. There is no, after a baseball game, everyone goes drink beer. It doesn't work like that. Your body will pay for it. You take steps backwards. It's all about presenting your body in the best condition as possible, and looking at the leanest as possible, showing the appropriate muscles. So it's the body doesn't like it. It's a very, very, very difficult state to attain, because you're telling your body that you want it to maintain muscle, be hard and strong, but you're also not giving enough calories to some extent, or you're maybe over dieting, so that your body loses all the body fat, and it's a very, very, very difficult equilibrium to maintain for very long. So these are typically, these preps are ready for shows, usually last around 3 months for most people. And if the athletes that are seasoned and know how to continue it, when they go into off season, where they restore more of their calories and they're getting more sleep, and their body's healthier, they don't fall off the wagon. You don't fall off the wagon, which means, eating a pizza every day, you're eating ice cream before you go to bed every night, you're drinking every night. That's called falling off the wagon. We're eating everything in sight, every Snickers bar you can find, and then you gain weight really, really quickly after a show, and then you go to the state of just a little bit of depression. I've seen that. Some people get into depression and they feel like, man, I just this was terrible, and I feel terrible and I look bad, and that's kind of a downward spiral typically. But the seasoned ones are able to maintain a lower body fat, and because they are more consistent with their diet and their exercise regimen. And so those people are more likely to take more time off in let's say their off season. How long is the off season? I don't know. 6-9 months. I don't know. It depends on how dedicated the athletes are to competing in the shows. But for bodybuilding specifically, the only time you want to do surgery is when you're in the off season. So that's very important, because your body is in a healthier state, because you're eating more, you're sleeping better, you're off any kind of supplements that you've kind of forced into for dieting purposes, or even anabolics or performance enhancing drugs. You want your body in a state of health, as healthy as possible, to tolerate surgery, because a surgery is a stressful event for the human body. It's actually very stressful. It can be plastic surgery, it can be orthopedic surgery, it can be a female surgery. All these surgeries, it's a surgery, people. Please don't take that lightly. I cannot emphasize enough. It's a surgery. You're having anesthesia. You're taking your medicine. You're being medicines that are put into your body to put you to sleep, so you don't feel pain. These medicines don't come without some kind of side effect. I would say in the United States, most of our medicines are very, very clean for anesthesia, but still you're putting your body under a lot of physical stress. That's why I have medical clearances for patients to go to have surgery. If you have any kind of heart condition, you're gonna get medical clearance. If you have any kind of blood disorder, you're gonna get medical clearance. It's all about safety. You can still die from a surgery. Every surgical consent you will sign says, I can die. It's not something to take lightly. It just isn't. Take it serious. So if you're gonna plan let's say a hernia surgery, or I want to get a tummy tuck, or I want to get a breast augmentation, if you're with me, you're coming to talk to me about it, my first answer is, are you in off season? And for the most part, I can see if you're in off season or not. But you need to be in off season where you're in a state of health. You're not in caloric deficit. You're exercising, you're feeling good, your body's ready to go to have surgery. In a state of prep, where you're getting ready for surgery, getting ready for a show, absolutely not. You're in a deficit, you're taking all these crazy supplements most likely. You're not sleeping as much, you're tired, you're exhausted, you're hangry. Not a good time. You don't want to add physical stress on top of the mental stress of trying to recover from surgery. And the recovery can depend on what it is, right? So breast augmentation, I get my patients back in the gym in 3 months. Guys for, gynecomastia, again, I get them back in the gym. We're doing training at three weeks. So kind of similar for them. I've had, met women who've, had knee issues. They get their meniscus fixed or something, ligaments or whatever, hernia surgery, all the same things. You don't want to do that before a show. It's just not a good idea. That recovery is not going to be fun because you're not going to be able to train as well. You're not going to be able to eat the right foods. You're going to be laying around a lot, so then you have to adjust your diet, or something has to change. It's going to throw your diet off completely. So please trust me when I tell you, just wait until you're in the off season, okay? And then plan the rest of your shows accordingly to accommodate the recovery. So great question. Appreciate that one. And stay tuned for next week. Thanks.